What are the downstream consequences of that? One of the consequences of the implementation of the Affordable Care Act has actually been that we have much better evidence than we once had on how insurance coverage affects both people's financial security and their ability to access healthcare, and then their ultimate health outcomes. And what that evidence points pretty clearly is, not surprisingly, gaining health insurance substantially reduces the likelihood that people face, very high out-of-pocket healthcare costs. It increases their ability to access care, including both sort of, routine care like doctor's visits, prescriptions, but also sort of more significant care like, a knee replacement or something like that requires hospitalization. And then it does seem to improve health outcomes. So, for example, there's been research specifically comparing, what happens to mortality rates in states that have adopted the Affordable Care Act Medicaid expansion versus states that haven't adopted the Affordable Care Act Medicaid expansion. And what we see is that the states that have adopted expansion have seen reductions in mortality relative to the states that haven't. And so I do think the, reduction in insurance coverage under this bill is likely to, have material consequences for the health of the people who are losing coverage, including in some cases that, some people will die who didn't have to.
Hey, I'm Hannah Cole, owner of Sunlight Tax, and I help creative, self-employed people like you understand their taxes and how to do the hard stuff so you can get back to your amazing work. You can find everything you need at sunlighttax.com.